Okay. All right, I'm going to start. Hi, everybody. I am Kelly Olchak. Thank you very much for attending today's riveting workshop. I'm actually really glad that everybody's coming. This topic's complicated. So we are going to be covering a lot of information. I'm sure a lot of people are thinking, oh my gosh, another workshop about healthcare. This is going to be so boring. I promise you it will not be boring, but we are going to cover an awful lot of information. I'm going to formally introduce ourselves here as we get started. I am Kelly Olchak, managing partner of Lindley and Company. We manage a handful of the finances. We manage the finances for a handful of families in the area. I'm happy to say that we're 100% woman-owned, registered investment advisory, which means we are a fiduciary. We're located in the Bushnells Basin. Joining me today is Chaz Miller, our operations manager, and my partner and co-founder, Becky Gillette, who is our dedicated chief compliance officer. We really want to encourage participation during today's meeting because there's a lot to cover. So Chaz is going to be our moderator, and Chaz, you're going to be helping us with the chat function of our session today. And you're also going to help us post the only poll that we're going to present to everybody. One of the things we pride ourselves with is we love to educate not just our clients, but potential clients so that you guys can become better investors. Healthcare is one of those things that really is important when planning for retirement, but there are a lot of moving parts. So I'm going to ask Chaz to post the poll right now. And if you guys could take a little bit of time on some of the questions that are text-based, that would be helpful because we want to make sure we're covering things that are important and pertinent to you guys. So I'm going to give you guys a little bit of time on that one. Thanks, Chaz.
I'm just going to give that like another 30 seconds or so, Kelly, to give folks time to read the questions.
Thank you. How are we doing?
We are doing good. I'm gonna go ahead and end that. Thank you.
Awesome.
Don't
Thank
want
you.
to cut
This was
anybody
really
off, but we did get 70% participation. So I will end it there.
okay. This is good. Robert, I am on that, on the TRICARE thing. Thank you very much. That helps a lot. Kathy, I hear you on the how and why bills get paid. Good question, Don Tubman. Thank you for that. Kathy, I got your back on enrolling. Earl, I'm glad to see you again, my friend. The options are complicated. We will definitely go into detail at the end of this. And then Sally, your question is a good one because I know you just moved from New York down to North Carolina. And that is, so this whole first part of the workshop is so important because everybody's situation is different. And that's why this workshop is a little complicated, and feel free to ask questions throughout. I want to try and get this to fit into an hour, but also know that everybody's situation is different. And I really do want you guys to raise your hand if I hit on something you want to know more. Okay. So Sally, thank you for your county. Paul, I know that you're in the United States. You're such an engineer. Awesome. Okay. So let me get back to where I was here. I lost my place. There we go. Okay. So thank you very, very much for that feedback, because it helps me guide the conversation. So we're going to cover 3 key points today. First big important point is, if you do not enroll on time, you may pay a monthly penalty for the rest of your life. A lot of folks, baby boomers especially, don't know if or when they are supposed to enroll. So hopefully today's workshop is going to shed some light on that. Again, anybody that has questions that want to talk clearly about their own situation, call me. I will help you. But there are very clear rules when it comes to signing up. And so we're going to cover some of that. If you don't sign up within a specific window, like I said, you could be assessed a monthly penalty forever. Second point, if you do not get the right private insurance to go with your Medicare, you may end up paying out too much in premium and out-of-pocket costs. Not a lot of people realize that Medicare is coupled with private insurance. So we're going to talk about that directly. Whether you're on original Medicare, or if you're on a Medicare Advantage. So we'll cover some of that. Some people think that Medicare covers everything, but no, it doesn't. In order to have prescription drug coverage and coverage for other out-of-pocket expenses, you need private insurance, like a Blue Cross Blue Shield policy or an Aetna policy. So we're going to walk through some of that. The third thing that we're going to do is talk about how, like, if you do not plan for higher healthcare costs in retirement, you could run out of money. People are usually happy to go on a Medicare when they turn 65 because it provides some relief against high health insurance premiums. But we need to talk about other factors that could contribute to higher costs later on. Okay, so here's the agenda. We're going to cover, I've divided this in 3 parts because there's a lot of information. So the first thing we're going to do is talk about Medicare. What is it? Who needs to enroll? How to enroll? When to enroll? Part 2 is we'll discuss how that private insurance piece fits into Medicare, whether you're taking original Medicare, which I'll explain in a minute, or Medicare Advantage. And then talk about what it covers, what it doesn't cover, and then how to integrate that with other private insurance options. Thirdly, we're going to talk about how plans for higher health costs in retirement matter. There are two reasons to do this. There's two reasons why healthcare expenses will be higher in the future, obviously inflation. But the other thing is that a lot of people are those boomers are getting into healthcare, Medicare right now. So it's driving costs up. Some of you may have experienced, maybe with a parent or a loved one, the need for activities with long-term care, how to take care of long-term care. So we're going to cover that. And a lot of people don't realize that Medicare doesn't cover long-term care. Okay, so, and Chaz, you'll help me if somebody has a hand up, right?
Yes, I will let you know if we get any questions in chat.
Vanna White, I appreciate that. Okay, so let's start with basics around Medicare enrollment. So who pays for healthcare in the United States today? Well, if you're under 65, your health insurance is usually work-based. If you're still working, your employer probably provides health insurance. If you're retired, we've got folks that are covered by retiree plans like teachers, or maybe you've just recently left a job and you have extended coverage like COBRA. Or maybe you're paying for your own health insurance through something called Healthy New York. That's actually another term would be the Affordable Care Act or Obamacare. After age 65, Medicare generally pays first. So, Robert, this goes to how does TRICARE, because you're retired military, thank you so much for your service. But you've got a TRICARE option. And so in that situation, Medicare would be the first payer, and then TRICARE would pick up after that. Or, as you'll see later, you might have different kinds of insurance and Medicare will pay first. So when you incur health care expenses, the bill is submitted first to Medicare in this situation. After Medicare pays what it's going to pay, any other insurance like TRICARE or a retirement health care or COBRA will pick up the rest. The only exception, okay, this is important. The only exception is employer groups that cover more than 20 employees or more. If you're still working and covered by such a plan, or if you're covered by a spouse who has such a plan, the employer will pay first. This has implications for enrollment, which we'll talk about in a minute. Okay. Okay. I've got this little button thing that won't let me move forward. Now, I will tell you guys, there's a lot of content we're going to be working through. This is going to be recorded, so you will be able to come back and look at it again if we move too fast, okay? All right, so here we go. What this means to you is that unless you are covered by an employer group plan that has more than 20 or more employers, you must enroll in Medicare when you turn 65, even if you're still working. Okay. What if you don't enroll in Medicare on time? And we have had folks that have done this, not on purpose, believe me. The consequences are pretty important, pretty dire. You'll be charged a late enrollment penalty. And the longer you go without enrolling, the higher the penalty will be, and it will last the whole part of your life, the rest of your life. The second consequence is that your healthcare expenses may not be covered by insurance. As I mentioned, Medicare is the primary payer in most circumstances. If you have other insurance, it will not pay its share until Medicare pays its share. So if you don't have Medicare, you could end up getting stuck for the whole bill, which really stinks, which is one of the reasons why we're doing this workshop. Finally, and I have to move this little box. I'm sorry. There we go. Finally, your private insurance options may be limited. If you're in poor health or you have a pre-existing condition, the private insurer that coordinates with Medicare, they have to take you if you sign up for Medicare during your enrollment period. But if you don't, you go to apply and you go to apply for private insurance later, you may be not able to get insurance, or you may be charged a much higher premium. So let's get enrolled immediately if you can. Okay. So what is Medicare? It's a national health insurance program for people over 65. It's probably redundant, but I'm going to say it anyhow for those of you who don't know it. It was signed into law in 1965 by President Johnson, and it's administered by the Centers for Medicare and Medicaid Service, but enrollment is handled by Social Security Administration, which until I did this homework, I did not know that. Who's eligible? Everyone over 65 is eligible for Medicare. This includes all U.S. citizens and legal residents who have lived in the U.S. continuously for at least 5 years. Some people under 65 can get Medicare if they have Social Security disability benefits. But today we're going to cover folks over 65. Okay. So what I like to say is a way to understand the parts of Medicare. A plus B plus D equals C. A plus B plus D equals C. So what does that mean? Medicare, as I said, 4 parts. Part A covers the cost of hospitalization. Part B covers parts of cost of medical services, such as your doctor visits, procedures, diagnostic tests. The bills for Part A and Part B are paid by Medicare. Okay, so the bills for Part A and B are paid by Medicare. Part D, your prescription, and Part C are where the private insurance companies come in. And the reason I'm putting D in front of C is because Part C is what maybe you've heard called Medicare Advantage. So A plus B plus D equals C, which is the Medicare Advantage plan. That is offered also through private insurers. So the Part D, if you decided to not do a Part C, your Part A and B are covered by Medicare. You have to get an insurance policy for your prescriptions. We're going to go through this more. And I am going to be redundant because I want you guys to think about Part A plus Part B plus Part D equals C. Okay, so when you sign up for a Medicare Advantage plan that's offered through an Excellus or an Aetna, the private insurance, how do I explain this? When you sign up for that kind of plan, a Medicare Advantage plan, through a private insurer, you get all your services from that private insurer, even though Part A and B are there. Your Part D is included in your Medicare Advantage plan. So for those of you that have had healthcare through work, it's very, very similar, okay? Now, some people don't want a Medicare Advantage plan, or they can't get a Medicare Advantage plan because there's none available in their county. Medicare is run at the county level. So you can get a Part D in any county. The Part D, as I mentioned, covers your drug prescriptions. And each prescription drug plan is slightly different, which is why you need to shop around carefully to figure out what fits you best. I'm going to go into detail more about that in a minute. So good gracious, I think I made that harder than it should have been. Okay, so this is why I was saying Part A plus Part B plus Part D equals C. On this image, you're going to see original Medicare, which is on the left hand of the screen. And then on the right hand of the screen is Part C. Both of these options say that prescriptions are optional. Please do not treat it as such. There's a huge ripple, even if you don't need prescriptions when you retire, okay? So next, okay. So before I go forward, are there any questions about these parts of Medicare before I move forward?
So far, so good.
Okay, so who should enroll in Medicare? If you are not receiving Social Security when you turn 65, more and more people are continuing to work past 65. In this case, you'll need to proactively enroll in Medicare during a Medicare enrollment period. And there are 3 enrollment periods we're going to talk about. The initial enrollment period applies if you're not covered by a group plan, a company plan that has more than 20 employees when you turn 65. So if you work for a small company, even if they offer health insurance, you still should enroll in Medicare. If your employer plan, see it, I've got a special note here. I want to make sure I'm very clear. And I am reading for notes here because it is very complicated. It's not that I don't know this. I just want to give you good information. If you're covered by an employer group plan because you or your spouse are still working, you have a special enrollment period, which I'll explain later. If you miss one of these enrollment period, then you would fall into the general enrollment period. So again, if you're not covered by an employer that has 20 or more employees, you need to enroll during the initial enrollment period. If you have a separation from service, that's where after you're 65, that's where the special enrollment period starts. And then the general enrollment period is when, if you missed it by accident, you have a window to sign up. Okay, so the initial enrollment period for people who aren't covered by a group plan with employees larger than 20 or more, you need to start at 65, and you have a window 3 months before you're 65 and 3 months after you're 65. And that means if you enroll in that period, you will not get in trouble. So you should really start and get enrolled as soon as possible so that you know that you're covered. By the way, if your birthday happens to be on the first day of the month, you should move everything up a month because there's a delay. For example, if your birthday was June 1st, your initial enrollment period would start February 1st. If you sign up during February, March, and April, your coverage would start May 1st. Who signs up for Part A during the initial enrollment period? We've been talking about signing up for Medicare as a whole, but there are times when we need to break it into parts. Most people will sign up for everything all at once, but there may be times when you'll want to sign up for some parts and not others. So if you're still working when you're 65, check with your benefits admin, your HR people, to see if you should sign up for Part A. We mentioned earlier that your coverage on bigger plans, you would have a special enrollment period later. However, you may want to sign up for Part A, even in this situation, as soon as you become eligible. And the reason is because you might have better coverage for hospitalization than your employer plan. Typically, Part A is free to you. It's part of your Social Security, but you definitely want to check with your HR benefits people anyway. If your employer group is a high deductible health plan paired with a health savings account, this is really important. So if you have a high deductible health plan and it's paired with an HSA or health savings account, And if you want to keep contributing to your HSA, you should not sign up for Part A. Okay. The reason is that once you enroll in Medicare, your HSA contributions have to stop. Any questions? Okay. If you're not covered by an employer group plan when you turn 65, you want to sign up also for Part B during the initial enrollment period. Initial enrollment period starts mid-October, like October 15th, and it goes until December 7th. So you want to sign up for Part B during your initial enrollment period, preferably that 3 months before your 65th birthday. So if you're not working, if you're self-employed, or if you're employed by a company that has fewer employees, or if you're on COBRA, even if you're receiving retirement health benefits, you want to sign up for Part A and Part B during your initial enrollment period. Okay, who signs up for Part D during the initial enrollment period? So if you've signed up for Part A and B during that period, the initial enrollment period, and if you think you will never, even if you think you'll never need drug coverage, you should still enroll in Part D. You have 63 days of grace period without what they call creditable coverage, prescription coverage. And if you miss that 63 days, you're going to get hit with a penalty. So it's better to just go ahead and get your drug coverage from the outset, even if you aren't currently taking any prescriptions. Any questions? Okay. That takes care of the initial enrollment period. Now we're going to talk a little bit about special enrollment period. This is for people who were covered by an employer with more than 20 employees when they turn 65. In this case, you will not be penalized for not enrolling in Medicare at 65, but you will be penalized if you don't enroll during the special enrollment period. The best time to sign up is before your current coverage ends. You do not want gap. So even if you have double coverage, you want to make sure that you don't have gap. But you actually have a grace period of several months to avoid late enrollment. For Part B, and again, that's hospital coverage, doctor visits, immunizations, that grace period starts the month your coverage ends at work and lasts for 8 months. Let me say that again. Part B, that grace period starts the month your coverage ends and lasts 8 months, but Part D is only 63 days, and that's your prescriptions. Okay. High level, you can avoid late enrollment penalties by signing up for Medicare during your initial or special enrollment period. But to avoid gap in coverage, which is even more important, please enroll early. All right. I've only had 1 or 2 clients that have had to fall into this general enrollment period. And the window opens every year from January 1st and goes through March 31st of every year. So if you missed your initial enrollment period and you missed your special enrollment period, let's say you missed it in July, you have to wait until January to sign up for healthcare. And that period, that general enrollment period, again, starts January 1st to March 31st. Coverage starts the month after you enroll. So you pay premiums today and your healthcare would start next month. So again, it's very important to know about these things. You really don't want to miss those windows. And if you feel like you might have, call me and we can help you find the right person to help you. So this slide deck just goes through, this slide in the deck just go kind of high level, gives you an idea of what we just talked about. And I recognize there's a lot of information here. Any questions?
No,
Okay.
none so far.
So how do you sign up for Part A and Part B? This part's very easy. As I mentioned, if you're already receiving Social Security when you're 65, you will already be enrolled in Medicare. If not, you can go on to ssa.gov. And again, I'm going to post these slides on the webinar, on the replay, so you can find it. But if you went to ssa.gov, apply for Medicare benefits, and that button will help you, kind of figure it out. And then, of course, there's a phone number. What I would recommend if you have to call Social Security during the month, avoid the beginning of the month and the beginning of the week, because people tend to slam the phones during those periods. Okay. Part B is not so simple. First, you have to decide how you want your prescription drug coverage. There's this thing called formulary, and that's your prescriptions, okay? Whether you want a standalone prescription plan or part of Medicare Advantage plan, in either case, you need to shop plans that are offered by private insurers. Also, know this, I have a great resource here in Rochester, New York, that can help folks in upstate New York. Sally, I know you're not in upstate New York anymore, but we can help you with that. Like I said earlier, Medicare is administered at the county level. So shopping for Part D or Medicare Advantage is a little technical because of the options that you have. Once you've decided on original Medicare versus Medicare Advantage, then you're going to choose a specific plan for Part D through an insurance company or through Medicare. Okay, phew. That was just part one. Here's part two, Medicare and private insurance. So this chart, when we're doing our financial planning and retirement planning, we really try and get an arm around what healthcare costs are. So this chart's kind of helpful in understanding the breakdown by average Medicare beneficiary for premiums and services. Now, when I say average, that's taking the whole country into perspective. I've got some slides later that'll kind of show you what the county level might look like for you. And I've also got a website you can go to find that sort of thing out. But almost half of spending, or in this case, $2,294, is for insurance premiums. Then there's another part, $3,166, that's spent on services, including long-term care. So the total out-of-pocket spending by the average Medicare beneficiary is just under $6,000. Now, the other thing to know is these numbers are from 2016. That's the latest information that was available. So let's focus on out-of-pocket costs paid by Medicare beneficiaries. And they fall into two categories. Obviously, the premium, which is Part B, paid to Medicare. You will pay Part B even if you get Medicare Advantage. Just something to know, okay? So there's the premium side, and then there's the out-of-pocket costs. Monthly premiums are paid to Medicare and to the private insurance companies, even if you don't have a Medicare Advantage plan for that Part D. The out-of-pocket costs include deductibles, your copays, and other services that are not covered by Medicare, like dental and vision. So let's look at the breakdown on monthly premium. So Part A for most people is free if you and your spouse have paid into Medicare for you or your spouse, I should say, have paid into Medicare for over 10 years. This is one of the reasons why people sign up for Part A as soon as they turn 65, because it doesn't cost anything. Part B, okay, but Part A, just so you know, okay, that comes out of your social security, that doesn't come out of your social security payment. Your Part B does. In general, it costs about $165, $164.90 in 2023. And that premium is adjusted for inflation. Now, I always thought that it would always go up. A couple of years ago, I think 2 years ago, it went down. So it's not always, but it is adjusted for inflation. Also, if you are a high income beneficiary, your Part B premium could be higher. But that Part B premium, as I mentioned before, and I will be redundant on many of these slides because it's important. Even if you have Medicare Advantage, that you're still, the $164.90 is coming out of your Social Security payment before you get it to pay for Part B. Then Part D varies depending on the kind of policy you need and the private insurance like Medicare Advantage that you need. Okay. This is a breakdown of how that Part B flows across all income brackets. And then in the middle, you'll see income related adjustments. So if you make a lot of money, that 164.90 is higher. Then the average premium to Part D, which also has an income related adjustment. Deductibles. So in addition to the premiums you pay, and if you have healthcare insurance through an employer, you're probably familiar with this right now, but there will be some out-of-pocket costs under Medicare. This is one of the reasons why people decide they really like Medicare Advantage plans, because Medicare Advantage plans can cover a lot more than the basics. So what we're looking at right now is what's called original Medicare. So when your deductibles come out, the first $1,600 of your cost for hospital come out of your own pocket before Medicare starts to pay. Some Medicare Advantage plans will cover that. For Part B deductible, it's reasonable to assume about $226 a year. And this is waived for some preventive services, such as your flu shot, mammograms, like I jokingly call them the well baby appointments. And then Part D deductible is about $505 per year after your standard Medicare design. But Part D is complicated, and we will cover that in a second, because it can't be easy. Okay. Then there's this other thing called coinsurance. So after you've met your deductible, there are some other costs. Medicare doesn't pay for your entire medical bill. If your hospital stay exceeds 60 days, you're responsible for about $400 per day up to the 90th day. And then after the 90th day, it's $800 a day. Now, again, some Medicare Advantage plans have options to cover these issues. Medicare pays the full cost of 20 days of skilled nursing care. After that, you'll pay $200 per day from day 21 through 100. If you need skilled nursing care after that, you'll pay full cost. And that's where long-term care insurance can come in. As for Part B, you're responsible for 20% of the Medicare approved costs. So what does that mean? Doctors who accept what's called assignment agree to be paid directly by Medicare and will not bill any more than the Medicare approved amount. Doctors who don't accept assignment may charge more. It's very important for you to understand that from your doctor. And it's okay for you to ask that question. If they don't charge more than 15% over the approved amount, Medicare will pay 80% of the Medicare approved amount, but you'll be responsible for 20% plus 15 over. Now, isn't this fun? Told you it wouldn't be boring. Okay, so Part D coinsurance. First of all, any questions at all?
No, you are doing good.
Okay. Under the standard drug plan design, the beneficiaries pay $505 deductible, and then they pay 25% of drug costs after the deductible has been paid. Then there's a small copay once out-of-pocket spending has reached $7,400. Drug plans vary widely, so some will pay more, requiring you to pay less, maybe meaning the drug plan will pay more, so there's less burden on you. And that's why it takes time to figure out the right plan. And I want you all to know that I do have resources that we partner with. We do not get compensated by them, by the way, but they help navigate these decisions with you one-on-one. Okay, so I am 20 minutes away from the end, and I've got another 30 slides. And if I go over this time, I'm going to go over because this stuff is important. So what does Medicare cover? After you look at your out-of-pocket costs that you have to pay, you might be wondering, that sounds kind of technical. What does it do? So it does cover the first 60 days of hospitalization minus the deductible, of course. It covers 80% of your doctor's bill, and it covers preventive, like I call it, well baby services. It does not cover these things. Now, in your handout, after we're done, and I'm going to send you guys an email, I'm going to have some attachments. And one of the things that's that's attached is called Medicare and You, and it's published by Medicare, and it's for 2024. It's a 20-page booklet. It's pretty comprehensive. Shockingly, there's only one page that covers what it doesn't care, right? And I'm not talking about partial payments. I'm talking about no coverage at all. Okay, so Medicare does not cover long-term care, dental, health, hearing, acupuncture, but Medicare Advantage plan might, okay? So this is where a Medicare Advantage plan comes in. Private insurance can cover all or part of your deductible. Those hospital costs after 60 days, the 20% of your doctor bill that Medicare doesn't cover. And of course, all the prescription drug coverage is offered through one of these plans. Then there's this thing called Medigap. This is a supplemental insurance. I think you guys have heard of the donut hole. Maybe you haven't, but there's a part of time, there's a period in your coverage annually that you might fall into a place where you cover everything. And that's where these Medicare supplement insurance or Medigap policies are issued. So the good thing about Medigap is they are standardized, unless you live in Massachusetts, Minnesota, and Wisconsin. But the government requires each Medigap plan to have the same coverage under letters, and I'll show that to you in a minute, okay? So the reason this is important, for example, in one Florida county, the monthly premium for a plan F ranged from $162 to $465. They cover the same stuff, but the premium was higher, okay? Okay, here we go. This is a Medigap plan, and it shows the various benefits that you can get to. This is covered in that Medicare and U booklet I'm going to send you guys. So you don't have to memorize it. And after 18 years, I still haven't memorized that. The main thing to remember is that when you're looking at a particular plan, it has to be the same. It has to cover the same things. The premium can be different, but it has to cover the same thing. So for instance, if you look at Plan F in upstate New York or Florida, it covers the same thing, 100% of Part A coinsurance, all the way down to foreign travel, okay? Now we're going to talk quickly about Medicare Advantage. I've talked about this a lot. So A plus B plus D equals C. So in Rochester, we have Excelis, Blue Cross Blue Shield. They have a Medicare Advantage, and there are different variations, but it would cover your A and B and D. And I'm not going to go through this slide again because I think you guys all know we got to go slow when we're shopping. Okay, so now, how do we plan for higher costs in retirement? So this is a chart that talks about different genders and age groups. Women tend to spend more than men in healthcare, and older people spend more than younger people. Duh. So here's when I'm building out a financial plan, I try and figure out what the annual amount would be per person. So this again, and this is A plus B and D, no Part C yet. Oh, I can't believe that didn't work out. All right. This is the number that this bottom number, 64.58. Because Medicare doesn't cover dental and health and other out-of-pockets. So what can cause your healthcare budget to change in the future? Obviously, inflation is a big deal. We talked about that a little bit. If you decide later to go into a Medigap plan because you keep hitting the donut hole, you might start in retirement with no prescriptions, and then as you get older, you have expensive ones. And I always say my crystal ball doesn't work, but these are things that if I were to tell you what keeps me up at night when I think about planning for retirement, healthcare is one of them. So when I do our clients' financial plans, I'm very pessimistic about this. I will assume it's higher than what it is today by a lot. Okay. So there are some studies out there by a couple firms. One's Fidelity, another one is Employee Benefit Research Institute, that looks at and says, you know, what's the average people pay over a lifetime? And, you know, Fidelity has one that says per couple, 315,000. I will tell you that those numbers are shocking, but the only argument my husband and I ever got to when we were first married was he said, let's save up before we have children. And I lost it because I said we'd never have children, billions of dollars later. And I'm all joking aside, I think it's important for folks to know that these costs add up. Okay. Planning for long-term care. All right. So I'm sure at least all of you know someone who has needed some kind of care as they've gotten older. And I'm not necessarily talking about nursing home care. I'm talking about there are different levels of need. And those levels of need are not covered by Medicare. The important thing to know is that Medicare and Medigap do not cover long-term care. The most comprehensive Medigap policy pays for 100 days instead of 21 days. Medigap policy covers 100 days of skilled care only, whereas regular Medicare only 21. But if you're not sick enough for skilled nursing care, they won't pay it. And before you say, I'm never going to get old and need help, consider this. 35% of people over 65 have activity limitations. Some of them need help with the so-called instrumental activities. Those are like, I need help shopping and cooking. Some other folks need help with bathing and dressing. So here we see the cause of activity limitations: hypertension, arthritis, cancer, asthma. When you're healthy and active in your 60s, it's hard to imagine not being able to bathe and dress yourself, but it's a fact of life. Not everybody's going to need it, but nearly half of all people over 85 have some difficulties and they're going to need help. Okay, so the levels of care, and I'm happy to say we're moving right along here. Any questions so far?
No, I do not have any questions in the chat.
So there's different levels of care needed. In-home assistance. So you might have seen locally here, Home Instead, Happier at Home. These are firms that have folks come in with housekeeping stuff, like making sure your bills are getting paid or taking you to go shopping. That's one level of care. Then there's custodial care, and this is where long-term care insurance would kick in. So a doctor would have to say, you can't get out of bed by yourself. You can't transfer from a chair to a bed. That's transferring. You need help eating. You can't go to the bathroom. That would, if you have long-term care insurance, that would trigger your policy. But that's called custodial care, not skilled care, custodial care. And then there's skilled care. And this is where you need a licensed nurse for medical condition or rehabilitation. We've had clients that have gone into they've broken a hip and needed time in a rehab facility. They come home later, but that's skilled care. And sometimes this level of care is short-term, like I said. Medicare and Medigap might pay for that. In the instance I was talking about, my client was only in there for 92 days. So Medicare cover that. But if it's longer than that, it won't. And so that's when the costs get really heavy. So thank you all for signing up early, because I did a little homework on the folks that I knew that were coming. And Sally, I'll get this number to you because you're down south. But in Monroe County, so this is the national average, right? So homemaker service, home health, that's the Happier at Home, adult daycare, assisted living. So that's the national average. But majority of everybody that's on the phone right now, or on this webinar, are in the Monroe County area. And you'll see there's a difference. And then Kathy Thode, Cayuga County, there's a difference. And then got a client that's in St. John, Virgin Islands. Thank you, Paul. Talk to you later. Okay, so this slide's in here. I was going to take it out. Why do you want to plan for long-term care? Well, duh. So you can make sure that you're not putting a burden on your family. But I wanted to keep it in here because, again, people who are on Medicaid don't have a lot of choices. So if you're young enough to consider long-term care, and we do not sell long-term care insurance, by the way. This is not a pitch. It's just our job is to solve problems, okay? So if you have questions about how to solve for this, we'd be happy to share what we know about ways to solve for that. And hot dang, I'm almost done. So 3 reminders. Enroll on time. Be careful when you shop for private insurance. And plan for higher retirement costs. And oh my goodness, I cannot believe I got that done in under an hour. Any questions? Don Tubman, do you have any questions? You're welcome, Michael. We'll talk again. I'm going to send out a follow-up email with a couple handouts. One is a Medicare cheat sheet. One is the Medicare and You. And I would really enjoy any feedback you folks have for us. I hope I didn't rush, but I know we covered a lot of info, so we'd be glad to circle around with you individually if you need help. Earl, that's another good point. I will include the referral for the Advantage plans. Thank you for that feedback. I hope you guys all have a wonderful Thanksgiving. And I'm very grateful that you guys showed up. Thank you so much. Thanks, Don. You're welcome, Kathy. Thank you.
Thanks everyone for coming. If you would like a follow-up appointment with Kelly, please shoot me an email or give me a call and we'll get something scheduled on the calendar. And with that, I will end our meeting. Have a great day.
Bye, everybody. Thank you.